Now I'm gonna treat abdomen. She has a stretch mark on abdomen, the here tummy. So I would treat it with scalette. The scalette is good for body. So you can treat the tummy, abdomen, and then you can treat elbow sagging or knee sagging, even butt, well, wrinkle under the butt. You can treat the hip. Yeah, you can treat it. So I use almond for body, and then depth. Usually depth I prefer 2.5 millimeter on tummy area, and then power. Usually I use 4 or 5. So I choose 5. For her. She has a severe stretch mark, and then set it, all set. So I touch, and then I start ready. So with my hands, you stretch it and then pull up and then hold it, stretch and then hold it, push it up, and then I would treat the vertical direction. And then here I would treat push up and then back and shot. So this is the center middle line, you see. So push it up and then stretch it, and then I start from the bottom. How about, is it okay?
Yes.
Yeah, thank you. And then yeah. After a shot, you look at the skin response. If it looks red erythema, then the power is good. But if nothing not happen, then you need increase one more level up. So now it's a little bit red erythematous, but very mild. So I'd better increase power one more level up, 6, and then I will try on beside of the first line. Then is okay. Yeah, you feel good. Thank you. Yes, and then see. Yes, is now is erythematous. So I go with this parameter. Good. Push up and shot. Yeah. Push up and back. The RF heat coagulate the old collagen fiber, and it induces new collagenesis in the skin. So after 1 month, the dermis, scar tissue, stretch mark area, they have new collagen fiber. And then the microneedle, it tear off the old collagen fiber, irregular bundle in the dermis. So it tear off all the scar tissue in a stretch mark. So it improve the stretch mark like this. So I shoot on the stretch mark. It is a kind of scar tissue. Then microneedle penetrate the stretch mark. Then the irregular fibrous bundle, they cut in small segment. Then the stretch mark is tissue become a little bit smoother, and then new collagen fiber coming 1 month later. Then they replace the regular fibrous bundle with a normal collagen fiber. Then finally, after your multiple treatment, usually I recommend 3 session or 5 session for a 1 package program. Then after 3 to 5 months later, they will have more smoother and then better shape and surface texture on the stretch mark. See, like it, like this. Yes, you feel good? Okay.
I don't feel nothing.
Oh, good. Yeah, thank you. So it's not painful, so you can treat in a comfortable. You see? Yes. Now I almost finished the right side of stretch mark treatment. Yeah. After treatment, you examine the side again, and then if you shot on stretch mark, then it looks red, and then you feel the surface this side and compare this side more smoother because the depressed stretch mark skin come up with the heat, so you feel the smoother, then it's okay. But when you find some stretch mark looks deeper, or maybe skip the needling, then you target and you feel you shoot on the skip lesion, and then here, yes, you do like this. Here skip, then feel it, yeah, here, and then here. So I finished this side, and then she has a little scar here. You see the scar. So this is the C-sex scar when delivery. So I want to treat this one. So it is same scar tissue. So I use the same mode and power 6. I use power 3, power 2, or 3, or 4 on face. The maximum power is 4, but I don't use 5 or 6 on face because face is more wet. It has more blood, so it induces more heat than body. Body is drier. So I don't use higher power on face, but I use a higher power on body because body skin is drier, so I need a more higher power, okay? So, and then this is scar, so I stretch it the skin, and then you remember, so I put the needle on the scar line to penetrate the scar tissue. Yes, like this. After treatment, look at it here. So my redness, and then the depressed scar lesions come up, yeah, popped up now. So look at it here, still depressed, and then let's treat it. Then you can add second pass on the scar tissue. Okay. Yeah, I did it 2 pass on the scar tissue, and then feel it. Yeah, now it feels smoother. So yes, I did it. I did treatment here, and then you can continue the other side as the same mode and same power and same length. Yeah. Thank you.